Hey everybody, welcome. I'm Michelle and this is Youth Therapy. Today we're going to talk about the treatments for post-traumatic stress disorder. In the last video, I went through the diagnostic criteria for PTSD, and what we can tend to do is divide them up into some larger categories. But if you're curious about the specifics for the diagnosis, please go back to that other video, and there's a lot of detail about that there. But oftentimes what we tend to do is first there's a battle with the symptoms. It's I'm not feeling this isn't happening, this can't be, it shouldn't be. Another response to symptoms is this avoidance. So avoidance of feelings, avoidance of places that remind you of the trauma or things that remind you of the trauma. And the third thing we tend to see with PTSD or other anxiety disorders for that matter is this self-judgment, a really intense negative self-judgment. And those are the three sort of main categories that we try to work with when reducing PTSD symptoms. And so if you identify yourself as someone who fits that criteria for PTSD, even if you don't fit the full criteria, even some of them, and it's causing distress in your life, I would encourage you to seek out a person who is a specialist with trauma issues. And so what I'm going to go through today is some of the types of treatment that are most research supported, empirically supported for treating PTSD symptoms. So the first one is called exposure therapy. And exposure therapy is when, in a safe place, the therapist will help you, instead of avoid, look at these things that are causing you the distress. So looking at the story, looking at what you experience, but pacing it in a way that feels safe and also giving you self-soothing, self-comforting tools so that as you expose yourself to the things you've been avoiding, you are not overly triggered. You will feel uncomfortable. Unfortunately, treating PTSD will cause a person to go through a great deal of discomfort sometimes. And so to have those tools, to have those skills to self-soothe, to calm down the nervous system are so important for PTSD treatment. And in other videos, I would love to kind of share some of those ideas for grounding, comforting, self-soothing. So exposure therapy is one way that PTSD, instead of running away from this monster, is slowly, kind of stopping, turning around and looking, and maybe even stepping toward it, stepping toward the scary thing. And we find that when we slowly step forward, the things that scare us, we see that they start to lose their power. They start to lose that force that they have over our lives. And it becomes looking at it with curiosity instead of just reactivity. A second modality that's used for treating PTSD is cognitive behavioral therapy, or CBT. You may have heard of it. It's the most researched modality right now. And cognitive behavioral therapy is really about identifying the thoughts that cause your feelings to get out of control, get you into overwhelm. So CBT is a very dry sort of therapy in that it's not really about your spirit or your meaning. It's really about being very analytical and rational. Is this thought rational? Is this thought true? And if it is not, can I challenge that thought, or can I just say, stop, we're not doing this, we're not having this thought? And there's a feeling good workbook and book that I might recommend if you really want to kind of start to learn yourself about CBT and how it might help you. Even though it's not the whole answer, I think having CBT skills is something that will benefit you your whole life, and it's very empowering to have those skills too. Instead of reacting and believing your thoughts, taking a moment and saying, that feels true, but can I really say 100% that this is a true thought? And if not, maybe I don't have to have these, bigger anger, fear, feelings because of the thoughts that actually were not rational in the first place. Another treatment for PTSD is DBT, dialectical behavioral therapy. It was created by Marsha Linehan to treat people who have borderline personality disorder. It's divided up into, sort of 4 main categories, and I'll do another video that really goes into detail about DBT. But the skills that you learn in DBT, I think, can be helpful for the feeling of overwhelm that we have in PTSD as well. So yeah, we use a lot of acronyms in psychotherapy, and it can be a little bit confusing sometimes. But dialectical behavioral therapy is a wonderful way to reduce distress, get your emotions regulated, get into sort of a pattern of mindfulness where you're in the present moment, and deal with the interpersonal issues that come up when people have PTSD. Because whenever we have sort of an overwhelm or a feeling that we're not ourselves and we're reactive and we're really uncomfortable all the time, of course our relationships are affected as well. So how can we learn to be effective on an interpersonal level as well? And DBT helps that. Another modality used to help PTSD are somatic kind of grounding experiences. So again, I will do some other videos where we'll do some somatic things together, but somatic is, about the body. And it's interesting because a lot of the trauma that we react to and the memory exists in this primitive part, the, kind of base of our brain. And oftentimes just talking, yes, can help, and to have someone who is a safe person to talk to can really help, but also through the body, because we get detached from the body, because the body can feel like an unsafe place to be, working directly through the body with yoga, with grounding, with anything that helps us feel friendlier to our bodies really can help us to reduce those PTSD symptoms. So somatic work through the body, there's many different ways of doing it. Some people do yoga, some people do somatic experiencing. There's a lot of different options as far as somatic work goes. EMDR, that's not something that I use, but it is something that a lot of people do believe help with PTSD symptoms or trauma symptoms. And that, if you've heard of it before, it's where you kind of go through the story and you follow the therapist's finger, or you have paddles in your hands and there's kind of a little electric shock that goes back and forth very, very lightly, that they don't really know why it works, but some people find that their symptoms are reduced when they use EMDR. So if you're interested in EMDR, I would search for local therapists who are experienced in it, and maybe ask some questions and see what you think about that possibility for yourself. And the last one I'm going to talk about today is mindfulness, because that is a modality that I use a lot for a lot of other issues as well, not just PTSD, but mindfulness. You have probably heard about it a lot in the news. There's a ton of research happening with mindfulness now because it's been shown to be so effective for depression, anxiety, substance use, eating disorders. So many issues are helped with mindfulness practices. And some people feel worried about mindfulness. They think it might be related to being religious or something, and indeed it does come from an ancient Buddhist practice, but in reality the religion is taken out of it. It's actually a skill that we can use to be in the present moment. And that is definitely something I will do another video on, and we could do some work together, some mindfulness practices together, to be in the present moment versus in the future or in the past. If you think about it, the future, the fears about the future, anxiety about the future, or the past, the terrible things that have happened there, are the places that we visit in our mind that cause us so much pain. But if we can come right here, right now, the only time that does exist, we can reduce sometimes that intense anxiety, that intense depression and pain, because we are here right now where we're usually okay to be. So mindfulness is a wonderful tool to learn in the right way. If you're extremely reactive and high tension all the time, then, you know, sitting and meditating is probably not a good place to start. So you will want to work with your therapist if you find someone who, you know, wants to introduce mindfulness to you, or if you find someone who's a specialist in mindfulness practices, or you decide to take it on, you know, on your own. I might put some links below in the video, you know, for anyone who wants to do, you know, just some reading, some research on that on their own. Just sitting and meditating is great for a lot of people, but it might not be a great place to start if your level of anxiety is so intense. So we can do walking mindfulness activities. We can do something where we're moving, and that can feel safer and more comfortable for people who have a lot of adrenaline and a lot of epinephrine surging through their body all the time. It's a very stress. Obviously, that's in the title of the diagnosis. It's the stress is so intense. And as we know, stress is really bad for our health. The bad stress, the stress that continues, is unrelenting. So we really do want to find a way to reduce the stress, reduce the tension as much as possible. We may not make it totally go away, but can we give you a quality of life that feels more comfortable to you? And that's what a lot of these, you know, modalities may do for you. So as difficult as it is to have PTSD, it's a very painful experience to have. There is a lot of hope. So I don't want you to give up or get overwhelmed with, you know, these long lists that I share with you. Know that there are ways to feel better if you commit to it, if you commit to feeling better and taking care of yourself. But number one is compassion, self-compassion. And I know it's hard when you have PTSD. So please put any questions you may have about these modalities in the comments section, or any requests you may have for more information about any of these modalities. Like I said, I'll try to do some videos going into more detail about them. Thank you so much for watching. I really appreciate your time, and I'll see you in the next video. Be well.